Sawadee-krab. Hi, I'm Dr. Job and I'm a board-certified plastic surgeon here at One Surgery and Aesthetics. So here we have an example of a skull of the patient. So as you can see here, if we remove the implant here, you're going to see that the skull of the patient has different texture from person to person, and there's a lot of variation in these underlying bony framework of the patient. So here we use a 3D digital imaging to let the patient see after the surgery what they are going to look like. And so here we can align the expectation of the patient before and after the operation. And also we use the CT scan or the CAT scan together with the image from the 3D digital printing to make a custom-made silicone implant. Here as you can see, so these custom-made silicone implant will have a perfect fit to the patient underlying bony structure and soft tissue. So I'm going to walk you through all the silicone implant that we have with an example. So first is the nose. In the past, we do a rhinoplasty without the 3D custom-made silicone implant. But here you can see that the bone here and the cartilage of the patient are so much different from one to another. And in the past, this silicone is not a perfect fit. So you can see complications such as the capsule contracture, and sometimes the silicone can move, and sometimes there is an extrusion of the silicone. But here you can see that if the silicone has been made perfect to the patient, it will be perfect fit such that there is no gap between the silicone and the bone, and hence these complications are much less. And also, since we can imagine image and what the patient are going to look like with the use of the 3D digital imaging, the expectation of the patient will be aligned with the operation that we do, and we expect that the satisfaction of the patient will be much higher. So in the past, without these technology, designing the silicone here around the upper part of the nose near the part of your eye is really usually difficult because the bone here is much different than the bone underneath. So, but with this 3D technology and the custom-made silicone implant, it will help in the sense that it can design the silicone that is very fitting to the curve around your glabella here. And the silicone will be tight, and it will also be a smooth curve between the nose and the forehead, and hence the silicone will not move, and it will be very perfect shape with the curve in the radix, and the patient should be very satisfied with this implant. So for jawline augmentation has been quite a challenge to surgeons in the past, because as you can see, the bone here, there is a lot of variation in the angle, in the curvature of the bone, in the cortical thickness of the bone, and hence to carve a silicone that is perfect fit to the jawline of the patient has been very difficult. But with this 3D technology and the custom-made silicone implant, we can carve the silicone, design it and print it beforehand in the sense that it is perfect fit to the bone of the patient, and the result will be a much smoother jawline. The operative time will be much shorter. A downtime of the patient after the operation is expected to be much better for a custom-made silicone implant. The next part that I'm going to talk about is the shin implant. So in the past, shin implant has been done very extensively in the plastic surgery in Thailand and worldwide. But the challenge of the shin implant has 2 points. One is that the shin can either be lengthened in the anterior to posterior direction, and it can also be lengthened in the cephalocaudal direction, in this direction. So with the 3D technology, we can create the implant that is very precise in the sense that the length in both directions can be designed beforehand, and the patient can see what they might look like after the operation beforehand. And this is the first part. For the second part, you can see here the bone of the shin has a lot of variation from patient to patient. Sometimes after the operation, the silicone implant can move, and we don't want that. But with this 3D technology, we can create the implant that is also very good fitting and perfect fitting to the bone of the patient underneath. Well, I think major concern that they have is that they don't know what they are going to look like after the operation. And these are a pretty big decision because it's a permanent change to their self, to their image. All of these concerns can be addressed with our technology, with the 3D digital imaging photo, and also with our custom-made silicone implant. Together with the patient, we can design what they expect and they want to look like after the operation. Also, we can align the expectation before and after the operation. And as I've talked before, all these custom-made silicone implants can greatly help to minimize the complication and the downtime of the surgery. So I hope that all these technology will help the patients to be less hesitant about going ahead with the plastic surgery operation, since all these operations can help change their image and the way they look and help them to appreciate and be a better version of themselves. For our custom-made silicone implant, the step would start with the consultation between the doctor and the patient. Here, we are gonna take a photo and use it in the 3D digital imaging program to simulate the before and after the operation, what you are going to look like. Here, we are going together, the patient and the doctor will design what you might look like after the operation. Second step is for the patient to take the computed tomography image in the hospital. Here, the image will be used to help to design the 3D printing of the underlying bone and the soft tissue of the patient, and also to design the custom-made silicone implant. After this, the data from the CT and the camera will be sent to the company to help to generate the silicone of the patient. Although the process might take long, up to a week to 1 month, all these will help to reduce the actual operative time later, and this will help to minimize the downtime of the patient. So next I'm going to show you the actual silicone that is being processed and ready for the patient, for our patient. So it will come in this box like this. So let's look what is inside. Okay. So there'll be two parts. One is the 3D printing of the bone in the facial region of the patient here, and the silicone will come in a sterile package like this. This silicone will be perfect fitting to the bone of the patient, as you can see here. And we are going to use this silicone without additional alteration in the actual operation, which will be much shorter than the one that we have to carve.